Member from Peace River North.
Thanks, Honourable Chair, and this is works out well. A bit of a follow-up with my colleague from Peace River South. For a number of years, and I know the minister and myself and the mayor of Fort St. John, the mayor of Taylor, the president at the time of the BCNU. We were on a telephone call. It's going back almost 3 years ago now, calling on an audit, an independent third-party audit of Northern Health. I know since then those calls have grown with the I know the Resource Municipalities Coalition wrote the minister a letter, which again included the mayor of Taylor, the mayor of Fort Nelson, the mayor of Mackenzie, Tumbler Ridge, Fort Nelson, Fort St. John. We've had recently at the last NCLGA, the North Central Local Government Association, therefore be resolved that the NCLGA and the UBCM lobby the provincial government to require review of the structure management of health authorities, so even broader than just Northern Health. And that was about 3 years ago when we first started calling for this audit. And I think I told the minister that day on the phone, this isn't trying to play Kochi or anything. We need to have those independent eyes looking at our health authorities. My colleague was talking about the diversions. I mean, Chetwynd has seen nearly 50 closures or diversions in a little over 2 years. Fort Nelson has had numerous diversions. Fort St. John, our emergency department, was shut down recently. So things aren't rosy. Things aren't working well in Northern Health, and we've heard the same stories, and I understand other local governments have called on reviews of their own health authorities. So I guess, first of all, I need to commend all of our frontline workers who have really stepped up. BC Ambulance, I know the minister mentioned BC Ambulance has been really increased, and I know in Fort St. John, my hat's off, like there was tons of ambulances there. Our nurses, our support staff and doctors, but it does not negate the fact that things aren't working well in our health authorities. And, we've seen it time and time again, whether we're talking these diversions, we're seeing wait times, transportation for specialist appointments. Something needs to be done, and I think, and many others believe that this audit, and I'll ask specifically as us, be done with Northern Health to find out how can we make things better? What is going well? What isn't going well? Where can we make improvements? And I understand that, they do fall under the Accreditation Canada, but that's a different piece than looking at the best way that we can manage our health authorities to deliver the best results. At the end of the day, we need to be patient-focused and what's best for them. And again, this has been called for a long time. I just wonder if the minister can address that.
Minister.
Well, thank you, Honourable Chair, and thanks to the member for question. I have spoken to him many times, and we've had this discussion. I had the discussion with members in Vancouver, Langara. I don't think people sometimes are aware of the extent to which we work together on these issues as members, especially in communities that are represented by members of the opposition. I've had the occasion to work with a member a number of times on issues involving long-term care, on issues involving acute care, on issues involving primary care in Fort St. John, for example, but other communities. Just last week, I had the occasion to meet with the Mayor and Council in Fort Nelson to discuss issues that they had, both with respect to diagnostic care, which is a real concern there, and the desire of that community to have a CT scanner, as the member will know, and as well issues around diversions and the recruitment of staff and the quite effective recruitment of staff that's occurred. My own view, which is different than the honourable member, is that we're having a lot of success in working with northern communities, and I credit both Northern Health and the communities for the work we've done together. I'll just give them an example of the work we've done. Northern Health set up for workers, to bring workers to community. Childcare support is a prototype to add to support expanded net new childcare spaces and expanded hours of operations to meet the healthcare needs of healthcare workers. Really critical issue, in particular in the north, in some communities where there was a lack of those spaces. So that's underway in Chetwynd, in Fort St. John, in Kitimat, and in Prince George. 36 spaces in Fort St. John, 24 extended hours childcare spaces, 21 spaces secured in Terrace, 32 spaces in Prince George, 12 additional spots targeted in Chetwynd, and so on. And this is the case of communities working together with Northern Health on joint projects. In terms of housing support, we've seen the same process that Northern Health, for the same reasons as discussed with respect to Chetwynd with the member for Peace River South, has obtained properties in Dawson Creek, in Fort St. John, in Chetwynd, in Valemont, in Kitimat, in Prince Rupert, and others. And these are partnerships often with regional districts, for example, and the members for Prince George Valemont's riding, the Valemont Regional District supported the purchase of a multi-unit home in the village of Valemont, for example. All the work that's been done with recruitment incentives, with the travel resource pool. In fact, Northern Health has been leading British Columbia in terms of recruitment because we have piloted initiative after initiative that's now going province-wide in Northern Health. I think the Northern Health team, we have strong representation throughout, including from the Peace Country on the Northern Health Board, as we have since I've been here, and they're available and excellent people. And my view is that we do have to have a close relationship with municipalities, and that's got to be working together on these issues of recruitment all the time. Because what happens in a smaller community is you can have a very stable group, and really there's no space for a new health professional, then suddenly someone decides to leave or retire, and suddenly, if that's two people, it becomes a very significant situation. So I agree we've got to work very strongly and very closely with municipalities, not in the context of audits, but in the way that we're doing right now. And I could go through the workforce support programs, the member knows about them, we don't need to go through them all, but a lot of those proposals are fundamental to the efforts we're making in health, human resources, and communities, involve communities working with Northern Health on joint recruitment initiatives, and we've got to continue to do that.
Member.
Thanks, Chair, and you know, I have to disagree with the minister. You know, and yes, there probably are a lot of successes, and I know the minister, you know, during different parts of proceedings in this place, whether it's question period or otherwise, talks about some of those. But the bottom line, and I negated almost to that little meme that you would see on Twitter or whatever, or X now, you know, the dog sitting at the table and everything's burning down around him, and yeah, it's fine, it's all good. Because it isn't good. Things are not good. I know the minister has been emailed and CC'd on the same emails that I get or my colleague from Peace River South gets. This is not my opinion that the minister had spoke about. We have a difference in opinions. I listed off the municipalities that have called for this, that says things are critically wrong. And there's way more municipalities than I listed. The thousands of British Columbians across northern BC that are saying it is not good healthcare in pretty much all levels. So, I asked for a response, but maybe I should have made it a question, and which I will do now, is we do need to look at how things are being operated in Northern Health. How can we do them better? What are the gaps? You know, and again, not having Northern Health looking inward and saying, yeah, we're doing a good job, or, you know, this needs to be an independent audit, which is good for any large corporation, such as health authorities or even municipalities. And many municipalities undertake third-party independent audits to find out those exact things. How can we do things better? That's all we're asking. And this is all these municipalities are asking. This is all the NCLGA is asking, is how can we do things better? And that is going to happen, I think, through an audit. Or maybe we call the health committee and do something on rural health care. But will the minister commit today, or at least entertain committing to an audit, or maybe striking the health committee and getting something looking at rural health care?
Minister.
Honourable Speaker, I think that promoting rural health care is at the core of the changes that we're putting in place. I don't look one way or another at issues. There are issues in communities around BC when you have health human resources issues. Even when we're seeing a dramatic increase in health professionals, that doesn't mean they're distributed in the way that we'd like all the time, right? And that's the case. And that's why we've taken action after action after action to support rural health care. The difference, I wasn't disagreeing that there are issues. I've met with health professionals in Fort St. John in the past 6 months. I've met with health professionals in Dawson Creek. I've met with in Fort Nelson and communities across the north. And my point to him is that we have in Northern Health, on administration costs, one of the most efficient, like health authorities, not just in Canada, but across the world, a relatively low-cost administrative health authority. And the health authority model was put in place by the previous government, and I've maintained it. I'm not going to get into that discussion. It's a model that's in place. So on that basis, they meet the test. There are real challenges in many communities in the north. Why we've taken such concerted action on ambulance service, because the system we had in place, which was a casual system, right, wasn't working any longer. We made a fundamental reform to the way we delivered that service. Why we're making so many parts of the Health Human Resources Plan focus on rural and remote communities and been modeled in Northern Health. So I think where I disagree with members, not that there aren't issues. I acknowledge when there are issues. I go and see people when there are issues. We work to bring resolution to those issues. In Fort St. John, for example, one of the issues is the need for more specialists in internal medicine, right? We need that at the hospital. We provide support to everyone in the hospital, and our recruitment efforts are in place. And some of those recruitment efforts are attached, and why we focus on issues like housing and childcare in the community of Fort St. John's, because we've heard from people in the community who said these are important issues in terms of recruitment. So I think we have to work together. I think community, just take Fort St. John or Taylor or whatever the community would be. Northern Health has to work with communities closely to address these very real problems that exist, because it's critical in a community. If an emergency room is on diversion, it's critical to that community. It's not a small matter. Even if it's overnight, even if there's a small number of patients affected on that given night, because we want a hospital like Fort St. John has to be open, and we have to build out primary care. That's why we've added primary care networks. We've added all these things to support those communities, and we're going to continue to do that. So I always encourage an organization like Northern Health, because the member raised issues in municipalities, to work with municipalities on our joint priorities in communities. I'm just disagreeing about the mechanisms, that's all. And but of course, where there are issues, we have to face those issues head on, and that's what we've been doing.
Member.
Just for clarification then, so that is a no to the audit and a no to even striking the health committee.
Minister.
I haven't supported the idea of the audit. When we discussed it before, I've been pretty straightforward about that. I think we have a team in Northern Health that's incredibly dedicated, that has an unusual challenge, right? And it is, Northern Health has to serve communities over wide geographic areas. And I think they're incredibly committed to that. I know our Northern Health staff is. But I'm not saying there aren't issues. I think we have to work with them. I'm just saying that we have to work positively with municipalities, for example, but many others, our unions and many others, to address those issues, and that's what we're working to do. And we've seen evidence of success that I think the member would have to acknowledge on the ambulance service, on BCHS, on recruitment in general, on the initiatives around childcare and housing and the recruitment efforts in the north. All of these efforts have shown significant progress. We've got to continue to do that. But what Northern Health faces are very real challenges that aren't about Northern Health, they're about the challenges, and we've got to attack those challenges together with people who want to do so in good faith.